Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hello, everybody. Welcome back to the Health Upgrade Podcast. This is Dr. Habib, and I am excited beyond words today. I have a really wonderful friend and colleague, Dr. Bryce Appelbaum. This episode of the Health Upgrade Podcast is brought to you by Truvaga. Have you been looking for a simple way to feel calmer, think clearer, and sleep better? Imagine achieving this with just 2 minutes a day. I'm excited to introduce you to Truvaga, a handheld device that supports your nervous system through gentle vagus nerve stimulation. As a doctor specializing in functional health and wellness, I've seen firsthand how Truvaga has accelerated healing in my clients. I've used this device to help people with a range of issues, from sleep disturbances and heart palpitations to digestive dysfunction, nervous system imbalances, and mental wellness concerns. The results have honestly been remarkable. Truvaga is designed to catalyze and accelerate the shift in your body from fight or flight to rest, digest, and recover mode, helping you manage stress, maintain mental clarity, and unwind more easily. It's not just theory. I've witnessed its positive impact on real people facing real health challenges. The best part? Truvaga fits seamlessly into your routine. No need to carve out hours for wellness. Just 2 minutes a day can make a difference. It's a small investment of time for potentially significant benefits in how you feel and function each day. If you're curious to experience Truvaga for yourself, visit truvaga.com/upgrade. You can save $30 on your device by using the code UPGRADE30 at checkout. Remember, that's truvaga.com, truvaga.com/upgrade. It might just be the first step towards a calmer, clearer you, just as it has been for many of my clients. So great to have you here, Bryce.
It is such a pleasure and honor to be here. Excited for this conversation.
We met in person finally like 3 months ago from this recording date. And I was so excited to connect with you because nobody knows about vision therapy. And I was exposed to this with my own family, with my own experience. My daughter actually went through a vision therapy protocol, and it was on the recommendation of our optometrist, who's a family friend of ours. And vision therapy changed her life. It entirely shifted what she was capable of, her confidence. And when I saw that, Bryce, you were speaking at this pediatric conference that you and I both were speaking at, I was just so excited to have this conversation, to share my experience and to talk about that with you. And now here we are. I'm excited to kind of get to know you a little bit more, to share your vision to the world, and to talk about how we can upgrade our vision to improve our overall holistic health. Tell me first how you kind of got into optometry and into this vision therapy experience in the first place. Where did you start out?
Yeah, well, I just want to say that's so great that your child benefited from this. And truthfully, every single person should have their lives changed with this type of work. And if it's not happening that way, that means either the patient or the practitioner is doing something wrong, because this has the opportunity to unlock so much of our potential. So, I mean, my story, I'm really a benefit. I'm here because of the work that was done on me when I was a child. And I was a freaking mess visually and emotionally and athletically. And, I was lost on the soccer field. I was in the classroom just having no idea what was going on. I had poor interpersonal communication skills. And really, the reason for all that is because of these visual developmental delays. So what that meant was my eyes didn't work together well as a team. I had poor depth perception. My focusing system had not developed yet. And so I really felt like a turtle retreating in my shell in all these aspects of life. And I really attribute all my success in life, athletically, academically, even just interpersonally, to what was provided for me in the form of office-based vision therapy and sensory integration-based occupational therapy. And the two simultaneously just completely rebooting my brain, but allowing me to learn what I didn't learn naturally on my own.
It's such a unique story, but again, in the functional world, we tend to get to this story of we experienced the issue ourselves and we benefited from something, and we now are advocating for and working with people in that realm. So your story, obviously having a personal connection, having a very specific improvements that you noticed yourself, I think drives this point home, just how important and how positive this tool is. I'd love to get a sense of what vision therapy is. Now, we're talking something a little different than most people have even heard, and most people will say, what the heck are you talking about, right? Like, I just got my eyes checked and that's it, and we're in good shape. So what is vision therapy and what does it help people do?
So I identify as a functional eye doctor, which means I look at eyesight and vision as these separate things. Okay. So just to give a little perspective, eyesight, it's the ability to see, it's letters on a chart, it's seeing the street sign, what the teacher writes on the board in the classroom. That's what glasses are for. Eyesight's a symptom. Vision, though, is far more complex. Vision is brain, and how our brain derives meaning from the world around us, directs the appropriate action, how it filters and processes information, and tells our eyes what to do. And there is a life-altering treatment with something called vision therapy, or what we call visual performance training, which is kind of like physical therapy for the eyes, but really for the brain through the eyes, because we see through our eyes. And what vision therapy does is it closes the gaps when there's a visual developmental delay, where a certain visual skill ability has not been developed at the rate or level that it's supposed to. Or vision therapy can rewire the software of the brain to change how somebody's using vision after a head injury or concussion, where vision, not eyesight, gets impacted 100% of the time. It's just a matter of at what level. Or for athletes, or for somebody who doesn't want their vision to deteriorate as they age, or to have their prescription increase every year, we can use our eyes to rewire our brain to establish order from all this disorder, but to exercise these systems. And just like we exercise our bodies, we can exercise our eyes and our eye-brain coordination so that things don't have to deteriorate as we get older. I mean, we all hear that your brain function drops and your visual system gets compromised as we get older. That's really common, but it doesn't have to be that way when we know better and we can do better.
I love that. I think that an important kind of takeaway here, common doesn't mean normal. I think those two do not equate to one another, right? Just because something's common doesn't mean that we should accept it as being the normal course through which things occur or that issues will take place. And this is generally what we say, like, as you get older, your vision goes, or, my knees are going to hurt or whatever, right? Like, we talk about these things as though age is the cause of, when in reality, it's just a common occurrence. It's not what is normal. Normal is optimal function. And I love what you've broken down here, the difference between eyesight and vision. Eyesight being just simply the ability to see, and vision being the entire perception and driving force of brain function and how the brain perceives the world and sends out signals to interact with the world in a very particular way, how it changes the visual aperture, how it shifts your visual cortex and actually turns eye muscles in a very particular way. And I've seen this change. I've seen this occur with my daughter. So I'll give you a little breakdown of how I became a big proponent of this. So my daughter, when she was 6, we went to the optometrist and we were noticing she was having a lot of difficulty reading. She hated reading, for the first thing. And when we sat down with her, she would skip lines. She would skip words. She was having a lot of difficulty just paying attention and focusing on a very particular word. And we said, oh, she must just hate reading. In fact, we even heard from some people, she's lazy, or these were the quote unquote words that were kind of shared. I said, this just isn't good enough for me. Like, something's not right with this explanation. So we went to the optometrist and just got a sense. We thought, okay, if she needs glasses, let's get glasses. So we went to our family friend, and our family friend did an assessment, and she came to us afterwards. And during the assessment, she said she doesn't need glasses, but what she has is a lack of ability to track together. Her eyes are not working together. The eye muscles aren't getting the right signals from her brain to work in conjunction with one another. And so what she's seeing is changing. What she perceives from her eyes, from her eyesight, is that these words are not in line. They're not connected. There's just randomness. So I need you to go see a vision therapist and go get assessed and see what they say. And let's do this. And she referred us to a local in Toronto here, a wonderful vision therapy clinic. And they did an assessment and they said she has convergence insufficiency was the specific diagnosis that we were given. And I appreciated that because it started to outline there was something going on with regards to brain coordination of vision. And they put us through a 12-week protocol where we went in with her once a week. Myself or my wife would take her for a 1-hour vision therapy treatment, I guess is the way we would call it. And through this period, they were doing these really cool exercises with her. They had her at certain points sitting on this board that was like swinging back and forth, and she had to keep her eye on a very particular thing, or she had these cards where she was looking at something down on the card, and then she was looking up at something up on the screen, or going back and forth. She even had these exercises that were given to us on the computer with being able to track and being able to kind of put pieces together. There were so many unique exercises. And I thought, let me pair this with something because I think we might be able to support her health a little bit more. Maybe we can try adding vagus nerve stimulation into her care with her. When we initially did the assessment, the doctor recommended, she thought maybe 2 courses of 12 treatments was the right amount of time. Usually about 17, 18 sessions or 18 weeks is what they expect to have to get to the point where her vision is much more aligned. When we got back on the 12-week assessment, the doctor said, I've never seen a kid progress this fast. So my experience with this is when she was doing these exercises, she was learning to use her eyes together. The eye coordination was becoming far more effective, and her vision started improving significantly to the point where she started reading out of her own choice and started reading chapter books. And within a year after completing her vision therapy, she had read something like 35 chapter books. I have goosebumps talking about this, right?
Yeah, this is so cool.
When it comes down to your kids, if you're a parent, and most people that are listening to this are a parent, we want the best for our kids. We want to see our kids functioning at a very high level in the world. And when you see that your child is not quote unquote lazy, or that they are not doing what they quote unquote know, what you know they're capable of, and then you see this shift occur, that is such an amazing and unique experience. And I know I'm kind of taking over the conversation here, but I wanted to share that the change that I've seen in my daughter since including vision therapy into her care, and these are exercises that we've continued doing, progressing post, because we know that once it's done, it's not like you complete an exercise course and that's the end of the exercise. We want to make sure that there's ongoing progress. So we keep using her syntonics glasses, and we keep doing the Brock string and all of these exercises. We've got a few of them that we do. And on top of that, she's a huge baseball, softball fan. She loves playing. And vision is kind of important when you have a ball flying at your head, right? Her teacher at school, her gym teacher, sent us a note saying that her aim is so good. Like, she has phenomenal ability to aim and hit a target with her ball. These are all outcomes of the vision therapy exercises and the tools that she brought in. I would love for you to dissect this case with me, and let's go through some of the unique things that we experienced with my daughter, and for you to share what we're learning or what we're seeing with regard to optimizing vision.
And there's so much to unpack here, but I think the most important piece of this puzzle is, like, you found the missing piece to allow your child to thrive. And I'm, of course, very biased, but vision is low-hanging fruit. And it's estimated that over 80% of what's learned in the classroom comes through the visual processing of information. And no matter what you read, the lowest percentage would say 1 in 10 kids has a vision problem significant enough to impact learning. And, I would say it's probably 4 times that, but that's still a high percentage. Oh, yeah. So normal human nature is we avoid stuff that's hard for us. And your daughter was losing her place and skipping words and skipping lines. And if it's hard to focus the eyes, it's going to be that much harder to focus the brain compared to if that was not the case. So often, a child like your daughter gets mislabeled as having ADD or ADHD or dyslexia, when these are all three incomplete diagnoses until functional vision problems that cause the exact same symptoms and behaviors are ruled out first. And really, these are visual developmental delays. She didn't learn how to use the inside and outside muscles of the eyes in synergy, most likely because she was born when she was born. If she was born when we were kids, this would probably be coming out later in life, because the visual demands for kids these days are unlike they've ever been. And kids are being introduced to screens at earlier and earlier ages and being asked to read at earlier and earlier ages before the visual foundation is in place. And really, if we don't have the tools in place to meet the demands, we adapt or we avoid. You mentioned convergence insufficiency. That's an incredibly common label that has a really high correlation with inattention or difficulty focusing. And by the language, convergence insufficiency sounds like we can't cross our eyes. But in almost every case, it has nothing to do with the strength or the length of the eye muscles. It has to do with faulty eye teaming or eye coordination and a spatial mismatch, essentially aligning the eyes as if she perceives where she's looking to be closer or farther in a different position than where it is. And when that happens, this really unstable eye coordination occurs and words move or go double, or we have a really hard time organizing what's in front of us and what's around us simultaneously. And from a vision perspective and from a reading perspective, there's all these words on the page and I can't organize these and I don't know where to aim my eyes and I'm getting lost. And it's like I got ants in my pants because I'm dysregulated. And so that's where I think you knowing better and incorporating one of the most important cranial nerves into all of this, where you're an expert, I mean, you got better results faster. And I think what's really neat with all of this is, you saw it transfer to the classroom, to reading, to life, to sports. I work with a ton of pro sports teams to help them identify who to draft or take as a free agent based off of who has gaps in vision development or who has holes in visual processing or reaction time or depth perception. And when we can identify those at that level, they send us the player, we close the gaps, and then they get that much more return on the investment or on the effort. We're all told from an early age, keep your eye on the ball, but none of us are really shown or taught how. Your daughter learned how. That's so cool. So I love that the gaps were closed. I love that she's able to access so much more of her capabilities and potential, but also think about the doors opened from a career perspective, from a learning perspective, even just from a happiness perspective. When we're struggling, nobody likes unnecessary struggling, and mental health gets involved when we realize we're functioning differently than everybody else and that things are harder for us. And then our thoughts can influence so much of life. And so I'm just so grateful that that unnecessary struggling was only for a short period of time and you got a direct route to a rock star to help her. And then the proof was in the pudding. I mean, that's really what's supposed to happen in every single case with the right work and the right motivation.
I love that. I love hearing about kind of how the brain, because the brain is just the coolest organ, isn't it? Like
it's there's nothing better. And this is all brain.
Honestly, and what we're trying to do with AI and generative AI is literally recreate brain, but at a faster speed, right? Using electricity, using electrical circuits. But we have it inside, and that's what we're trying to recreate, which is kind of cool. I want to talk a little bit about what are some of these important brain circuits? What are some of these important inputs where vision are heavily impacted, right? We know, obviously, we live in a visual world. We take in all of these things that are happening around us, a squirrel that's running by, or the car that's driving in front of us, or the ball that is coming by, or reading words. What are some of these unique visual areas within the brain outside of just the occipital cortex? And let's talk a little bit about the circuitry that's involved in ensuring that eye movements and eye functionality can improve with that overall concept of vision.
Nobody wants to dive deep. I love diving deep. Thank you. All right. So light enters our eyes. That's the initial signal. It strikes the back of our eye, or retina, where there's these photoreceptors, which have rods and cones on them. We can talk about what those are for and how they function. And then our retina forms these kind of retinal, what's called ganglion cells, which then all converge to the optic nerve, the cable that sends the input from our eyes to the back of our brain. Optic nerve leaves our eye, goes back to the optic chiasm where they cross over and there's this intersection, and right visual field information is processed on the left side and vice versa, and it's kind of complicated. That track then sends everything to my favorite part of the brain, the LGN, the lateral geniculate nucleus, which is kind of like the train station that filters what trains are going in which direction and what responds to central input and how we respond to peripheral input. And then from there, it sorts it prioritizes what needs to go where and why and how, and then continues to the back of our brain to our occipital cortex. But I think for at least your audience, who are obsessed with autonomic function and stress and what we can do about stress, the most common response to stress from a vision perspective is our pupils widen and we get this tunnel vision effect. And it's like we're looking through paper towel holders in life. And when that happens, we literally stop processing central focal visual input and peripheral ambient visual input. And it's like World War III could be going on around us, but we don't even notice because we're so locked in. And that happens at a scary level for many people when they're driving or going over a bridge, when all of a sudden you're aware of what you weren't aware of and you lock in even more. Or with stairs or elevators where we're not trusting what we're seeing, or from stress from our environment and too much screen time. I mean, the profiles we're seeing now post-COVID of the focusing muscles and the external eye coordination muscles, the inside and outside muscle systems not working in synergy, and then the maladaptations that emerge and the far away blur because of the near problem, or the using one eye for one distance and one eye for another, or the headaches, eye strain, fatigue, light sensitivity, disrupted sleep. I mean, the symptoms are so pronounced, but it literally is from this autonomic dysfunction, this fight or flight response, where literally we are just so tunneled in that it becomes really hard to navigate through space or understand sense of self in space or even process information. And with your daughter who's done enough work in this space, like she can selectively shift back and forth. But ultimately for anybody, I mean, there's certain eye exercises or procedures we could talk about to actively open up periphery. But really, when you can get that balance between those processing systems, then motion sensitivity is no longer an option. So the amount of people who get car sick when they're on their phones or tablets or in the back seat, I mean, that's a visual problem that's treatable. And if it's better when you're driving and way worse when you're not, I mean, that's diagnostic for your eyes and brain not working well together.
This is an interesting one because when I'm driving, my wife might be on her cell phone for a little bit and she'll sit there and she'll be like, oh, I'm getting sick. I feel sick because I'm focusing on something narrow while obviously the world is rolling around. And this is a very common issue, right? Like I'm sure you hear this all the time. And
all
in
day,
fact,
every day.
There's a really interesting test that can be done for autoimmune type of activation that's occurring. Have you ever seen that image of the lady with the two sets of eyes above and below and the two mouths above and below? And it's almost like this purposefully stretched out image that if it causes people to become nauseous or to feel uneasy, there's often a driving factor of some sort of inflammatory or other issue internally. You're nodding as though you know. So tell me a little bit about that.
So, I think how we process information influences so many aspects of systemic function. And when there's systemic inflammation and neuroinflammation, vision is always a piece of that puzzle. And if we're ignoring it or disregarding it, we're leaving a huge piece of the healing journey still on the table. So, there's also over in the last couple of years, a lot of social media images that come out on like, what color is this dress? Or do you see the picture of the cow or do you see like a duck? And we have a lot of these and we post them on social because it's fun to start conversations and see people's perspectives. But it's really looking at how we are selectively either shifting visual processing or taking in space. And if we can alter how somebody sees and we can improve their vision guides movement and behavior. We can improve their overall visual behavior and ultimately behavior in life, which can unlock so much potential and is pretty profound when you think about how many areas of life that can extend to. I mean, the amount of patients we see who, misplace their keys, let's say, or forget the most finite task because, well, with keys, they're looking for their keys here and here and here. But if they're not looking here, opened up with their periphery, and then they see, oh, it's right in front of my face. And so somebody with that kind of central focal processing very often has an esophoric or esotropic visual profile, meaning they're aligning one or both of their eyes closer in space and where it's located, versus the person who's seeing the whole forest but not each individual tree. They're more exotropic or exophoric, meaning they're perceiving things farther back in space and where they are. And to be able to control how our eyes are coordinating as a unit and how our brain is responding to that information can avoid so much unnecessary struggling. But even driving at night in the rain in unfamiliar territory with the windshield wipers going across, I mean, that's like a recipe for disaster for so many people because they don't know where to not look and where to look. And they're not just kind of simply being visually and taking in and processing. They're actually activating and trying to control what is often uncontrollable. So vision is a massive piece to so many different challenges. And I love that we're talking about motion sensitivity because almost any structural reactive doctor would say, well, motion sensitivity means your inner ears, there's some sort of fluid that's dislodged, or you've got Meniere's disease, and that's it. I mean, that's like 5 to 12% of the population. And even with those, there's a visual component in most of those cases. But the other 85-ish%, I mean, motion, we're not meant to be like your wife looking at this computer, blasting our eyes, making these really careful eye movements on this machine when we're in motion, much less with our loved ones taken in space. And yet that's what everybody's doing because that's the life we're in.
Such a uniquely modern issue that we have here with these tiny little supercomputers in our hands. You've mentioned with regards to vision some of the challenges that social media and the use of like these screens and our time that we're spending on screens, as well as obviously COVID and some of the developmental delays that happened around the lockdowns and whatnot. I'd love to hear some of the more common root causes behind these vision challenges and why the developmental delays tend to occur in the first place, right? We're seeing it more and more, like you mentioned, in younger kids early on. And you've mentioned screen time, so I'd love to get into that. But what are some of these major root causes of these visual tracking issues?
Screen time is the new pandemic. The average American spends 7 hours and 4 minutes a day on a screen. The average 8 to 10-year-old spends 6 hours a day on the screen. And I know Canada is a little different, but not too different either. So that's not, I mean, these are everywhere. I'm not anti-tech. I'm not anti-screens. I'm just very cognizant of what it's doing to us, and from a research and data collection standpoint, but then also from a clinical perspective. So the simplest piece of this that impacts literally everybody is nearsightedness, or far away being blurrier than up close. That's myopia. Right now, about 43% of America at least is nearsighted. And when we landed on the moon in 1969, about a fourth of America was. And it's estimated now that by 2050, 50% of the world will be nearsighted. And that includes countries that don't have access to technology and education like we have. And the reason for this is now threefold. We know not enough time outdoors is a clear risk factor, and 90 to 120 minutes a day has been proven to be protective in terms of onset, progression, and the severity of nearsightedness. And this is getting natural light from the sun. This is engaging with three-dimensional space. This is getting away from all of what the other two are, which is prolonged near work in the dark. So reading, writing in the dark with poor illumination. And then the big one, excessive screen time. And so what happens is the problem is up close. The root cause is either the accommodative system, the focusing system, the version system, the coordination system, the tracking system, combinations of these. And we could go into any of the three most common profiles that we see. But really, that's the problem. The symptom is far away blur. And the reactive medical system that we're in, with every doctor so heavily focused on the pursuit of seeing the 20/20 line and the smallest letters far away. And if they don't do that, then they're apparently selling their patients short. First of all, we all don't see the same. We all don't need to see the same. We should all be shooting for 20 happy rather than 20/20. And the ideal prescription is the weakest lens as possible that gives the most improvement, that's the most balance between each eye, but that improves performance. So adults' prescriptions should not be changing every year. If they are, clear sign of a functional vision problem. Kids are changing often because development is taking place, but mainly because we're adapting to the lens that we're in, needing something stronger to maintain that same clarity, going down this vicious cycle without even acknowledging the problem. And if you hit the problem, at a minimum, it slows down. In most cases, the change stops, at least at that in real time. And in many cases, even reverses. So this is crazy because, we have increased risk factors for disease processes that are preventable, and also just happiness in life to not be able to see stuff. Nobody wants to be able to not be able to see stuff. So I think that's kind of the biggest low-hanging fruit because of just how many people in glasses and contacts around us. But then kind of like your daughter, the functional vision problems that are impacting eye movement control and depth perception and a visual vestibular disconnect, which is making kids dizzy and nauseous, and adults and motion sick when they're on screens, not even when they're in motion, like that's crazy. That's the signals not being received appropriately and balanced appropriately, and different systems telling our brain that different things are happening and just being confused.
Meaning it's a brain processing problem, not an eye problem, not an ear problem. It's a processing issue.
It's a processing. And it's, the same processing issues that influence dizziness parallel the same processing issues that influence reading. I've yet to find a patient that we couldn't improve their reading ability. And we see tens of thousands of patients. And the amount of people we see who are just so self-identified or told, yes, I'm dyslexic and I have dyslexia. It's not like our brain is born with missing the piece that allows us to read it, right? I mean, it's faulty communication between the language processing centers, the auditory processing centers, the visual processing centers, and then not learning how to use these systems in synergy to develop the ability to read.
And most people have essentially found ways around these issues, which are more challenging, but are ways to function in the world without this. But I think I want to provide some hope to people. And I think you mentioning the fact that you've seen tens of thousands of clients and had some improvement with essentially every single one of them.
100% of them.
I want to say, is it possible, truly possible, to improve your vision?
It is impossible not to improve your vision. I mean, if we know what to look for, if we do the right work and we're doing it for the right reasons, any brain at any age has the ability to rewire itself. Neuroplasticity exists at every age. I'm almost 42 years old. When I was in school, I was taught, along with every other doctor, that there's this critical period for neuroplasticity and for visual development. And after your 8th birthday, you blow out the candles and then poof, what you see is what you get and you're stuck, right? This is literally misinterpretation of the research that is for vision loss, not for vision gained. So what I mean by that is if either of us were to cover up an eye with an eye patch for 6 months, you take off the eye patch, we'd be sensitive to light, but we'd still be able to see. You take a 6-year-old with an eye patch for 6 months and take it off, there will be vision lost. There'll be eyesight lost, probably vision as well. But any brain at any age in terms of what can be reestablished, developed, or gained, I mean, we have a 92-year-old right now in office-based treatment developing depth perception for the first time. Now, the brain's a little more malleable when you're 6 compared to 92, but I mean, the proof's in the pudding.
I love this. I feel like we could talk for hours and hours. Neuroplasticity is such an important thing for people to understand. And I love that you've brought this up, that yes, there are certain moments in time, there's certain periods in which neuroplastic benchmarks, exactly, that's a great word for it, that we need to bypass in order to, that's the developmental moment where things are working or not working. And neuroplasticity doesn't end. It does not end, period. Your brain can rewire at any age, period. You're mentioning this with the 92-year-old in your office that's getting depth perception for the first time. It can happen in a 40, 50, 60-year-old very easily. So many people resign themselves to the fact that now that I'm quote unquote older, I can't change. And I think it's so important to change that perception and then change your vision perception. But then
in all aspects of health, right? I mean,
totally.
so, and we all like when we get in our 40s and 50s and our arms aren't long enough and we're holding things farther away. I mean, you brought up initially, like, when we have aches and pains, like if your knee starts hurting, you don't just jump into a wheelchair. And I know this is a little hyperbolic, but the equivalent of that with vision is it's a little hard to see up close. Great. Let me go grab over the counter readers and have it do all the work for me.
Totally.
We have patients in their 60s, 70s, 80s doing work, but not needing reading glasses. And if you could think back to our ancestors, the cavemen, who were scanning the horizon for the saber-toothed tiger coming at them, they were still using near vision for eating and crafting and writing on cave walls. They didn't wear reading glasses. And I know the times are different, but just like any muscle in our body, just like any sensory system in our body, if we stop using it, we lose voluntary control.
That's amazing. You're going to love this. Many years ago, my mom, so I wear glasses for everybody who's just listening, and I've worn glasses since fourth grade. It was when it was determined that I had, the chalkboard was blurry and I needed glasses.
Fourth grade is when we used to not learn to read, but we read to learn. Visual demands increase. And so that's when we see a big emergence of a shift.
That's really cool to hear. My prescription has barely changed, but it may be 0.25 since fourth grade. So I want to say the fact that I haven't progressed significantly into that is one really cool thing. But my mom taught me eye exercises when I'm talking like 25 years ago. And she started doing these eye exercises where her goal was to improve her vision prescription, to not need her glasses as much and to not have as strong of a prescription. And she started doing these eye exercises, and she went back for her optometry appointment and her prescription got better. And this was for me the first moment where I said, oh, damn, we're not resigned to the fact that we are in a very particular, like our eyes are the same way, or our brain. There is adaptability and capability for change to occur. And so my mom's in her 60s now. She wears her glasses 50% of the time and doesn't 50% of the time. She's not spending as much time on screens. She still makes sure she's outside. And she still, from time to time, does her vision exercises because she knows what it did for her to maintain her optimal visual capacity. Mm-hmm. I think that's a really cool thing. So I wanted to share that with you because talking about how we can change our vision and there are tools to change vision prompts us to talk about what are some of the cool things that we can do. Where can people start? What's a good way to assess vision to determine if therapy or visual exercises will be beneficial for somebody?
Yeah, well, so first of all, if your glasses prescription's increasing or changing every year, immediate red flag warning sign, something's causing that. And so often we hear from our doctors, these are going to feel a little different. You're going to get used to them. Yes, our brain can adapt and get used to them, but that's a clear sign it's the wrong prescription. And so, for yours to not change in so long is, I think, a testament to just how knowledgeable and proactive and intentional you have been in terms of knowing what is possible and focusing on functional health and equilibrium. But that's so not common. I mean, I rarely hear that. And so, I think what we can do, there's number one, taking a ton of breaks. And I know in your fantastic book, you talk about the 20-20-20 rule, which is at least every 20 minutes, taking a break for at least 20 seconds and looking something at least 20 feet away and essentially disengaging and getting our visual system a little bit of a break. I would say while we're doing that, we absolutely should be incorporating movement. And, vision is intended to guide movement. So we should get up and move around. We should be drinking a lot of water. The average person blinks 15 times a minute. And when we look on the screen, it goes down to 3 times a minute, which means literally your own tears are going across the front surface in a different consistency than they were. And the windshield's cleaning off the debris less, and there's dryness. And then your brain sends a signal to release more tears, but it's more of the watery layers rather than the oily layers. And your own tears evaporate even faster, and we go down this vicious cycle. So blink and get up and move. Our focusing system are this inside muscle inside of our eyes that's a sphincter. It's circular. So if everybody listening were to squeeze both of their hands in fists and squeeze them as hard as they can, after a few seconds, your hand starts to hurt, right? But if you were to let go and squeeze and let go and squeeze, you could do this for all day, essentially. Getting up and looking away from your screen is literally letting go of your focusing system, because when we are doing what we are doing right now, staring at the screen and being exposed to the brightness and the contrast and the glare and all the bad junk light coming at us, our focusing muscles are locked in and they're under tension and they're under stress. So getting up and moving is really important. Happy to talk about top 5 exercises we could all do.
Let's do those.
Okay. And we have a really cool online vision training program called ScreenFit, which is intended to not rely on any equipment. And each lesson is a video of what the exercise is. And it's 30 new lessons or 30 exercises in each course. It's really robust. We created it all because not everybody has access to somebody who does really elite level office-based vision therapy or visual performance training. So that's kind of for the masses and almost like a body weight work for home rather than going to the gym and working with a trainer. But stuff we could all do starting today. So let's say top 3. So first one, it's called near far focus. And this is kind of like doing push-ups for your focusing system. So if everybody who's listening and not watching, take one hand and cover one of your eyes, take the other hand and stick up a finger and start your fingers far away from you. And you're going to bring it as close to you as you can down your midline until it gets a little blurry. And then right there, stop and try and make it clear. You're going to hold it. You're going to think about looking hard, locking the focusing system in. Your pupil's going to get smaller. You're going to try and you're going to notice, okay, I can make this a little clearer. Make it as clear as you can. Hold it for 5 seconds. And then relax your focus. Throw it out into the distance. Look across the room as far as you can for 5 seconds. And disengage and kind of visualize the pupil getting large and looking softer. And then back at your finger for 5 seconds. And then back at the distance. You're essentially grossly constricting, relaxing, constricting, relaxing. And the more you do this, the more you'll realize that finger will be able to get closer. The same amount of time, right eye as left eye. And most people will probably notice that with one eye, your finger's actually being able to be held a little closer where it's clear versus the other's a little farther. And that lets you know literally your focusing muscles are engaged at different planes, but you probably never knew about it. So when you're on the screen, you're almost having this kind of binocular rivalry or competition over which eye to use because it's hard to use both together.
This is awesome. This is very much the Brock string that my daughter uses with her vision therapy. The same idea, being able to focus near, focus far, and then one eye at a time with the patch thing that goes over her eye.
And so the Brock string is fantastic. I tell people this is the most boring exercise we have that gives more feedback than anything else. And it's all what you learn from. If you're just doing something to do it and there's not learning that takes place, it's likely not going to deliver a whole lot. But with the Brock string, I mean, there's different beads. There's jumps you do from bead to bead. There's crawling from bead to bead. We have 36 levels of our Brock string progression. But ultimately, it's raising to somebody's awareness where their eyes are pointing, how they're taking in space, and how to resolve some of that confusion. So the Brock string is really kind of the outside muscles, the convergence system. This near far focus is kind of more the inside muscles, but these systems, you can't use them independently of each other. It's just the near far focus we're covering an eye so that we don't have to converge, because that just adds a whole other piece to the equation.
A second layer, of course. Yes. So that's awesome.
That's number 1. Should we go through the other 2?
Yes, go for it.
Second one would be eye stretches. So cover up an eye, look as far up to the ceiling as you can, hold it for 10 seconds. And you don't want to go too high that you can't hold your eye steady. So if your eye's kind of darting around, that means that's a little too high. So go a little bit lower. And then as far down to the floor as you can for 10 seconds. And then to the left and to the right. And then diagonals as well. Same thing. Right eye is left eye, same amount of time. And then third one I think we should do would be peripheral pointing. And this is a really good one to kind of counter what we were talking about previously when there's stress from the environment and we kind of get locked in with this tunnel vision. This is going to teach you how to actively open up periphery. So what this is I think let's start by doing it one eye at a time, but you're going to find something kind of straight ahead. So for me, I'm looking at the light switch on the wall across the room. You want to keep your eye pointing in that and don't move your eye away from that. And then you want to find something else in the room without moving your eye there. So I'm going to look at this lamp that's all the way in the corner. And so what you want to do is point to where you think the lamp is without moving the eye there. Your eye's still looking straight ahead at the light switch. When you think you're right on it, then look over and see how close you are. And you realize probably too far in or out or up or down. Bring your hand back down, try again. And then as you do this, you'll be able to expand these concentric rings to be able to engage farther out in the periphery. But you're essentially kind of painting the periphery and actively activating that area of processing. Something like this can be done on a walk even, where when we're walking, oftentimes we're not really thinking about where we're looking or what we're doing. If you can actively open up periphery, you'll see, all right, there's a house here, there's a mailbox here, but it's really hard to see them both at the same time unless we're actively turning on both light switches and being aware. So trying to really be aware of bilaterally everything around you. I've had many patients talk about, even just on sharing this on a podcast, they were having a panic attack when they were driving and they started doing this and it literally pulled them out of it. And there's countless exercises or procedures that can be done, but ultimately, you're getting the right ones for where you are and getting the right baby steps to climb out of where you are. But I think it's important also to recognize, like your mother who did eye exercises early on, a lot of people say, well, eye exercises don't work. Those are the same people that say normal exercise doesn't work, right? Exercise works. You got to do it and you got to know what to do and you got to do the right stuff.
That's such a good point. Yeah. But exercise for real, exercise anywhere is good.
Yes.
When you know what you're doing and how to do it properly.
Absolutely. And then the really kind of robust therapy programs, physical therapists, occupational therapists, speech therapists, or even coaches and trainers, they're visually enhancing their work. They're incorporating vision into what they're doing because vision doesn't operate in isolation of these other systems. And it's our dominant sensory system. It should be tying together all of the input from every other system to be able to allow us to derive meaning and then direct the appropriate action.
With vision being the dominant sensory system for most people, what are your thoughts on giving it a break from time to time, from closing eyes and allowing the other sensory systems to turn on? What are your thoughts on that? Or even on the idea of visualization? Are there cool kind of unique pieces to the visualization, how we can perceive that we're seeing something without actually seeing something? And what are the circuits that we're engaging there?
Yeah, the sensation and perception is fascinating. So even just as simple as spelling a word or being introduced to somebody and forgetting their name. If you're able to visualize and see their name written out, you'll be able to remember it better. If you're able to spell a word based off of how it looks rather than how it sounds phonetically, you're going to spell it more accurately. Our ability to think in mental pictorial images and to see in our mind's eye, we're not born with that. It comes through learning through our life experiences. And it comes through seeing that things look differently from perspectives other than our own. And doing somersaults and realizing, whoa, when I got up, I'm in a different place than where I started. Or seeing that this is mom's face, even if mom's face is coming from a different angle. So visualization and visual thinking are one of the four big pillars in my mind of vision. And when I started meditating 2 years ago, and like you said, shutting off present sight, but activating more vision in, neurocognitively, my life changed completely. And I'm in the process now of figuring out how we can analyze and understand what areas of the brain are activated during vision training, but also during meditation, where we can learn how to get into different brainwave states faster and more deeply based off of where we're looking and how we're engaging. And in so many areas of medicine, there's pieces of this. Even with EMDR and eye movement based therapy for PTSD, we know that if we're looking up and to the left, we're trying to access a stored image. But if we're looking up and to the right, we're usually trying to fabricate ones. You can tell somebody's lying based off where they look sometimes. But exactly like you said, our ability to think in our mind's eye and higher level visualization is so important for so many aspects of life, including manifesting and visualizing the future and seeing what you want to come. I could get really spiritual here, but I think that is something that is not tapped into the way that it needs to be.
I love that. I think this is a huge opportunity for people to learn that visualization and creating kind of these unique perception-based neural networks
Yeah.
can really drive how you show up in the environment. And so many people that practice visualization do so well in life. They generally are much more successful people. We would talk about meditation, but during that meditative process, there are visualizations that are taking place. And there's differences between obviously like an active meditation where you're trying to manifest something or a much more passive, breath-focused meditation. I feel like both are great tools at different times for different people, right? So I think that's a really cool tool.
And we do a lot of visual performance training for athletes, but not just the small ball sports. I mean, I work with Olympic skiers and race car drivers, and so much of the work we're doing is exactly that. It's visualization. It's running through your entire slalom route, knowing exactly what you're doing and what step, but you can train that. You can train visual memory, visual sequential memory. You can train, how to think and organize many, many, many steps ahead and to get your brain to store more input than it normally would. And especially going at high speeds, like reaction time matters way more than it does it going at lower speeds.
I've heard these really cool studies that are being done of people that are practicing piano and the difference between visualizing your practice of piano and physically practicing piano. The difference is not as drastic as you would imagine, right? Like you can visualize your way through a tactile practice and gain a lot of benefit even when you don't have the piano in front of you. Yeah. It's a really cool thing.
So I forget which book this was, but I remember hearing a study about how they had two different groups. One group went to the gym and worked out their biceps and did all the stuff. And then the other group literally went through the mental reps with their biceps. And there was still muscle growth with that group that physically didn't do it.
I love that.
How cool is
that? Isn't that like, that's the ultimate use of the placebo effect? Isn't that just like, you can hack your health using your visualization and really driving like changes in your body without physically needing to utilize your body. How freaking cool is that?
So cool. And you can hack your vision just like you can hack your microbiome and your blood levels and your hormones. I mean,
that's awesome.
Yeah, it's crazy because I'm biased, but from a vision perspective, there's so few of us who do this functional work. And again, we're all trained how to intervene when there's disease and how to be reactive and how to get stronger glasses and, whatever. But there's so much more to the puzzle than that. And I do think we're getting to a tipping point because we're seeing how much screens are ruining all of our eyes and brains. And most normal eye doctors don't have solutions.
Yeah. My bias on creating health has a lot to do with the autonomic nervous system. And essentially, if our body shifts towards a more rest, digest, recover state versus a more fight or flight state. And I know vision plays a major role here. Tell us a little bit about how vision impacts this sympathetic, parasympathetic back and forth. And what are some of the unique traits that we can, or little tips that we can utilize to shift towards more of a parasympathetic, calmer, rest, digest, recover state, or to catch ourselves in that more sympathetic state with a visual signal or visual input?
I think it really starts with central versus peripheral. So with the sympathetic response, heart rate goes up, blood pressure goes up, all the neurochemicals that are released, that, the adrenaline, the cortisol. But what happens is we get pupillary dilation, our pupils get larger, our functional visual field gets restricted, our focusing system gets relaxed, and our eyes start to diverge, really to prepare us for what's coming to react. And I think the parallel we talked about before of there's a saber-toothed tiger coming at us and you need to get the heck out of the way or fight back if you're crazy. But either way, like that's your body getting prepared for danger. That same danger response is literally what happens from stress from our environment visually in the form of screen time, reading before we're ready, driving in an unfamiliar territory in the rain, in the dark with, no idea where we are. And that's something that actively opening up periphery and looking softer and kind of being able to pull out of it is really the key there. It's easier said than done unless you're like your daughter or so many of our patients who are going through individualized programs where literally like a seesaw, she's learned how to balance these systems so that she can selectively lock in or open up depending on the task, but it's happening unconsciously, automatically, and efficiently. And, with enough work, this becomes a part of you. And then in my opinion, if we've done enough, we don't need to continue maintenance because maladaptations have been removed and development's going to take place, but it all really has to be integrated. And so that's kind of a whole another scenario there. From a parasympathetic standpoint, that's the rest, the digest, like you said, kind of the healing, but visually that's our pupils constrict. That's our peripheral awareness gets increased. Our focusing system gets stimulated. Our eyes converge, and then our functional range of clear near focus gets increased. And so that's kind of the sit back and let go. And that's where we can really drive home focal processing. And so the stimulation of the focusing and eye teaming systems to be able to lock in. And so kind of the perfect profile for a baseball player, let's say, is one who can be in parasympathetic state, can diverge their eyes, can align their eyes out a little, and then the second they need to, lock in so intensely that the ball's slowing down and they're in flow state and they can prepare their body more quickly and accurately than the average person because they know they're hacking their brain and their brain's ability to respond to visual input. That's something that typically shows up when the speed of the pitch changes in terms of development in baseball, and when changeups come in and fastballs, and then it's like that time space continuum is all thrown off. We can develop the synergy between these systems so that things are single and clear all the time, rather than so many people listening who probably notice that sometimes words get a little blurry, but they're single, or that maybe even split to two, but they're clear, because we're using these two systems in opposing fashions because it's too hard to use them together. So that's really that kind of locking in tendency where we could talk about kind of a near point of convergence and learning how to really get that near space comfortable. We could talk about there's certain lens powers that we'll use to build up strength and stamina, kind of like you would build from a 5, 10, 15, 20 pound dumbbell to get to that level that you want to be able to curl. But then also we heavily utilize technology, and we do virtual reality and augmented reality and eye tracking computers. But we have different programs developed with virtual reality where we can literally blur the world, but ask the eyes to converge to develop that feeling tone of what it looks like, feels like, and the depth that ensues when the eyes work together versus when they don't. And then adjust dynamically the clarity or the point of focus to then literally establish new neuronal connections to support that.
I love this. Being able to understand that how we are attentive with the world, how we show up with the world, and how we perceive visual inputs, and the state in which we're in or the state which we create literally changes our ability to perform in the environment the way that we want, right? And I'm sure you see this, but the difference between being able to see a 96 mile an hour fastball versus a 78 mile an hour curveball coming into you at the plate for a baseball player is drastic, right? And so when you have that powerful capacity to differentiate and you have the ability to know where the ball is going to be, you can more likely to hit it or to know where it's going to be. And just how powerful that is, not just in sports performance, but in life performance, and the ability to perform day to day, right? Can you read the email without it causing an emotional reaction? Can you read the book and take in the important information and process it in the best possible way? Can you experience the world in a way that creates objectivity and doesn't shift you into an emotional upheaval?
Mm-hmm.
And then can you show up more confidently in your day-to-day life? And that's the transition that I've seen with my daughter. That's the transition that I'm so excited to have been able to provide to her with her with her vision therapy and this entire process for her. And I'm hoping that at some point she'll be able to see that 96 mile an hour fastball versus the 78 mile an hour slider, right? Or curveball. That's what every parent wants, is for their child to do that. You mentioned ScreenFit. What are some of the really cool tools that are available, and where can people find more of these tools and your resources?
Yeah. So our practice website is myvisionfirst.com. We have a ton of really good information on there. We are now seeing almost as many patients from out of state as we are seeing locally. And so we have these intensive programs where people fly in for a week and we put them through this crazy long boot camp. And you can get about, in most cases, between 3 and 4 months of treatment accomplished if you were local, accomplished in a week's time. And then we put you on a home program, and there's a lot involved there. So that's all on there. ScreenFit is on there as well. That's also on screenfit.com. Great resource. We've had as young as 5 and as old as 89 go through it successfully. Every time I say this, I want to knock on wood, with 100% of people who've gone through it seeing a reduction in symptoms. And we've had a very high volume go through there. And so it is looking at a screen to help become more screen fit, but it's just looking at a screen to watch the video of what the exercise is. You put it down, and then these are exercises you can do in the bathroom, at a stoplight, waiting for your kid or with your kid, being picked up from school. And they're meant to just kind of keep vision top of mind, but also to really loosen up and expand how we're using our visual system and how we can decrease a lot of the stress that's held in our eyes through our daily life. And then there's really cool products on there like digital performance lenses, or really glasses that go way beyond just blue light filters, but that for kids can help make screens less terrible, and for adults, but really for kids whose visual systems are developing. And then lots of really cool information on all our social media accounts, where we try and just educate and empower so people recognize they don't have to live the way that they are right now, even when healthcare has kind of let them down.
I love that. I didn't get to talk to you about junk light and the use of kind of how we can change our inputs via kind of the use of glasses or the use of particular lenses. We'll get into that in a future episode.
Yeah, love it.
All of the links that you mentioned we'll share on the show notes. So for anybody who wants to take a look at ScreenFit and really get into improving their vision and utilizing it to improve their confidence, support their kids' health, whatever it is, I think this is a phenomenal tool. And I cannot share just how deeply and strongly vision therapy has helped my family, and how much I want to get this out to as many people as possible. I've brought it to her school. I've brought it to as many people that, like, they go to their optometrist with their kid and they're like, they need glasses. I say, go and check what's going on with their vision therapy, or if they've been diagnosed with ADD or ADHD, go and check and see. Because often the answer is lying in how that child is perceiving the world. And what we can do is we can change these things. I think that's so powerful. Any final thoughts there, Bryce?
Yeah. Well, first, I am so grateful for you and helping getting this message out there, and so wonderful that you're seeing firsthand, the life altering power that this work can have. I think I would love to give advice to everybody listening. First of all, when you go into your eye doctor, ask about your vision, not just your eyesight, and you'll probably get a weird look from them, but that's a good thing, because you're going to be educating your doctors on what else to look for. But also, if we have headaches, often we go to a neurologist. Or if your child's squirmy in the classroom, maybe you see a psychiatrist or a learning specialist. Or if you're motion sick, maybe you're going to an ENT or whoever you're going to. But with almost every symptom, we really need to consider that vision could be a part of the problem, and is probably a part of the problem. And that's why I just really advocate putting our vision first, which goes way beyond, just seeing if you need glasses from the eye doctor.
I love it. Take care of your eyes, people. Your vision, your eyesight, your ability to perceive the world. It is your primary sensory input for the world. And you can imagine, if you have poor sensory input, your ability to perceive the world is going to be shifted. And I can't overstate how important that is. Thank you so much for joining us today, Bryce. I know JP wanted to be on today. For those who are listening, normally it's myself, JP, and a guest. JP is sick, so unable to attend today. So we'll have to schedule a follow-up where we can have the engineers' input into how the visual system and health are so heavily integrated with one another. But for those who are still listening, thank you so much for joining us. And please share this episode with just one person who you think could use this information to benefit and upgrade their health. Thank you so much for joining us today, everybody. And we'll catch you on the next one.